Okay, so now I'll be giving my patient medication through their NG tube. So what I'm going to do is first I'm going to check the MAR, and I'm just going to see the name of the drug, the route of the drug, the time that it has to go, the rate that it has to go, and the amount, also known as the frequency. I'm going to check it beforehand. I'm going to check it while I'm preparing it, and then I'm going to check it again at the bedside with the patient. I'm going to see if they have any allergies by asking them, and I'm also going to check it in the MAR. So, my name is Stephanie. I'm going to be your student nurse for today. Can I please have your name and date of birth? Okay, perfect. Thank you. So now what I'm going to do is I am going to take this a little medicine cup, and I'm also going to not touch the pills, but I'm going to make sure that these can be crushed, and if I'm unsure, I'll call the pharmacy. I'm going to pour them in here, and then I'm going to mix it with 20 mLs of water, and I'm going to then crush it with the 20 mLs of water if it is crushable. And then if there are several medications to be given, I'm going to have to do this for each one. You can't just mix them all together and put them in that way. So after I do that, I'm going to make sure that my patient is in a high Fowler's position, and I am going to check the NG tube placement. So I can going to do this by placing this inside of the and I will aspirate it, and I'll check. And again, I have my gloves on, and I did everything that I did before as well. I assessed the environment and all that stuff, and now I'm just checking it. So I can check it by aspirating it. So I'll place it in here and draw some up. I'll just make sure that it's not curdled, and I'll make sure that the previous feeding went in okay, and that it's that green color, which it is. I'm going to take some, and I'm going to put it into this bowl. And then I'm going to check the pH, and it should be between 1 and 5.5. I'm also going to measure from the near down to the end and make sure that it's the same amount of tubing as it was in the EHR, as well as the X-ray has been done already as well. So now that I'm ready to do the feeding, I am going to, I checked the residual, and that was good. I'm going to flush it. So to flush it, I'm going to be using this open system. So I'm going to be taking this out, and I'm going to be taking this cap out, and I'm going to be sure not to touch to contaminate. I'll be placing it in here, and I will be flushing it with the amount of water that my policy states. I'm going to clamp it a little bit just so that it doesn't go in too fast. And that seems like it went in nicely. I also already did do, I didn't say it again, but I said that I did it before. I already inspected their GI tract and their respiratory tract as well. Well, respiratory system. Okay, so it went in well. So now I'm going to pour in the medication mixture that is the crushed with the 20 mLs of fluid. So I'm going to be pouring that in. Okay, so that went in well. And how do you feel? Do you feel okay? You're not nauseous or anything? Good. So now, after the medication goes in, I am going to flush it one more time. So I'm going to pour in the water just to make sure that it's not going to clump up or anything. Perfect. So now I'll be taking this out. I'll be recapping it. I'm going to recap this as well. And I'm just going to leave this here. And you're tolerating that well. You feel okay. Perfect. So just if you need me, just give me a call with the call bell. And I'm just going to leave you sitting upright so that way you don't aspirate it or anything. So just please stay in this position. And you could just call me if you need me. Okay, and now that I've finished giving my medication and doing my enteral feedings, I'll take off my gloves the proper way. and perform hand hygiene by washing my hands for 20 seconds, and then I'm going to do documentation.